SHO, CT, ST, Clinical Fellow. You've likely heard of these job titles, but what do they mean? Who do they apply to? And should you be applying for these jobs? I'll be covering these questions in today's video. Welcome to my channel. My name's Effia. I'm a doctor based in the UK working in the NHS, and I make videos for doctors wanting to work in the UK. When graduates finish medical school in the UK, they do their internship year, and that's done through the foundation programme. The first year of the internship is called the FY1, and to do that, a doctor needs to have provisional registration with the GMC. After 12 months of doing the FY1 role, once they've successfully passed that, they then move on to the FY2 role, and that lasts for another 1 year. And during the FY2 role, they will have their full registration to practice. In the FY2 role, the doctor becomes known as an SHO, and that stands for Senior House Officer. You may have come across jobs for non-training FY1 and non-training FY2 jobs, and these are essentially for doctors who have full GMC registration, so they're not really FY1s because you can only have provisional registration to be an FY1. They have full GMC registration but are doing a non-training FY1 job or a non-training FY2 job that's not part of the foundation programme. And the reason that doctors do this is to gain experience of working within the NHS and within the NHS system, or if they want a junior role or don't have the experience to go to a more senior role, they can continue to work at that level with full GMC registration. FY1 and FY2 job titles are relatively new. They've only been around for a few years. So the old names of House Officer and SHO are still commonly used. So you'll see job titles for those jobs, SHO roles and House Officer roles. The SHO job title is quite broad, and it caters to doctors who are in their second, third, fourth year post medical school. So an FY2 is classed as an SHO, and somebody who's been working for 3 years, 4 years, 5 years, even longer can be classed as an SHO. You're technically still an SHO until you gain your membership exams, and then you qualify to move up the career ladder to a registrar job. So because the SHO role is quite extensive, there are several titles used to describe that career band. And as I've mentioned, SHO, FY2, there's also another job title, which is Junior Clinical Fellow. That's another quite common job title that you'll come across. And with the Junior Clinical Fellow roles, these do have some research or teaching components to them, more so than the generic non-training FY2 roles. So if you're interested in teaching and if you're interested in research, then it would be a good idea to focus on those job roles as well. Within the SHO job title, for training roles that cover the SHO career level, you'll find FY2, IMT, which stands for Internal Medicine Trainee, and ST, which stands for Specialty Trainee. IMT 1 and 2 and also 3 cover the SHO grades, but once you reach IMT 3, technically you are working as a registrar, and ST1 and ST2 cover the SHO level of a specialty trainee doctor who's in specialty training. Once they reach ST3, they become a registrar. So as I mentioned, you do have to pass your membership exams to get to your ST3 level. But for some specialties or some training programs such as IMT and also GP training, a doctor in their third year of that training program doesn't have to have passed their membership exams in order to complete the year 3 level of that training program. But obviously they will have to pass their membership exams to then progress their career. So for GP trainees, in their ST3 or third year of GP training, they sit the membership exams and then progress on to becoming fully qualified GPs. And for IMT3 doctors, they pass their membership exams in the third year of their training, and then they progress on to their specialty training, becoming registrars and then consultants, hopefully. So in summary, the job titles for junior doctors starts from FY1 when you do your internship year, then FY2 where you do your second year post medical school, and then you would work as an SHO. If you're in training, you would work as an IMT if you've gone into internal medicine training, or an ST if you've taken another specialty training route. And if you're not in training, then you would be classed as an SHO. So that would also include the job title of a junior clinical fellow. So you would work at that level. And then after passing membership exams, you would then progress onto a registrar role. There are alternative routes to getting into a registrar role without having to go into specialty training. This is done through gaining competencies which trainees have to gain, and then showing that evidence to show that you're competent to then get a registrar role. However, for international doctors who depend on a work visa in order to stay in the UK, that really isn't advisable, because your work visa, as I've said, is dependent on you being here. So if that work visa is cancelled, you will have to leave. The best thing is to get a training post, and that training post will come with a work visa, and then you can obviously use the training post and the work visa to progress your career, stay in the UK and get a registrar role. So if you've got membership exams but you have less than 4 years of clinical work experience, will you be able to get a registrar role? Unfortunately, no, you won't. You do need to have at least 4 years of experience, because technically you need to have done FY1, so year 1, FY2, year 2, IMT or ST 1 and 2. So the earliest technically you would be able to apply for a registrar role would be in year 5 after you've finished medical school. So great that you've got your membership exams, that's fantastic, but you won't be able to get a registrar role. But having the membership exams will definitely put you ahead of other candidates when you're applying for junior roles such as clinical fellow, SHO, or if you decide that you want to go into the training program. Definitely it's an advantage to have. I hope you now have a better understanding of the different grades within the junior level. If you found this video useful, please do give it a like and subscribe to stay updated on weekly videos that I'll be releasing. Bye-bye.